it has been a minute since we hooked up, yeah. I just started a channel and then things just spiraled downhill, and we couldn't be able to make do. But here we are. We thank God. It has been a journey. COVID has been here. For those who didn't know, COVID has been here and it has wreaked havoc. My God, I don't know, but as a believer, I just want to thank God for this far that He has brought me, especially me and my family. It has not been easy. We've gone through a lot, and I think I just want to thank God, because if it was not for His grace, I couldn't be here. It has been close to a year, yeah, since I posted my second video on my channel, and I knew that we are going to be together, and it was a good beginning, yeah, and I could feel the vibe, yeah. For those who had subscribed, thank you very much. Those who viewed my videos, thank you very much. And I know I disappointed, and many people unsubscribed because there was no content. I really understand, but I didn't mean to disappear on you just like that. Things happened, yeah, and just a sneak peek on whatever happened. I lost my job. Of course, many people did, but I thank God. He kept my health because I was sick in and out of hospital for one reason or another, but that one we'll discuss later. But yeah, I'm back here, and today, actually, what really made me say, you know what, I really need to pull back myself and get back to my people and just share one or two things. There's this thing that has really been bothering me about this COVID, yeah, and you guys, I want you to know that I am that person who says COVID is here, yeah, and it is not something to play around with. This thing is mutating from when it started to just COVID-19 to going to different variants to this deadly Delta variant that did a lot of not very good stuff in India. Many people died, and it's the same thing that is happening here in Kenya right now. But and now we are thinking of Lambada variant. Yes, it is being investigated that it's here, Lambada variant. So yeah, this thing is going to mutate, and it's not going to end tomorrow or a day after tomorrow or next year. So it's up to us to know what we are supposed to do. And first thing first, guys, let us take the vaccine. Let us take the vaccine. Even if people are saying that the vaccine is not effective, people are still getting infected. Yeah, well, that is what the vaccines are here for. Yeah, you get infected. The vaccines actually don't prevent you from getting the infection. For those who know, we have been vaccinated and immunized for various infections, but we still get, even the kids have been vaccinated against rotavirus, but the kids still get the diarrhea. But now what it does, and please, I want you to hear me very well, what the vaccine does, it prevents you from getting the severe forms of the infection itself, but it doesn't prevent you from getting that infection. It just protects you from getting the severe forms of the infection. So here with COVID, the vaccines that we are getting, the Covishield, the AstraZeneca, the Johnson & Johnson, the Sputnik, yes, these are just things to build up your immunity over it, and to give you some antibodies, so that when you get the virus itself, your body already has some foot soldiers on ground to be able to fight the disease, so that you don't end up getting the severe forms of it. Yeah, I know there are people who've been vaccinated but still get the severe forms of COVID. I want to put across, there are so many reasons as to why you can get a severe form of an infection, even if you've been vaccinated. One is you might be having an underlying undisclosed infection. An underlying undisclosed infection is the one that even you've gone through you've been able to cheat our normal ways where we do the normal blood counts, we do the other normal body checks that we go to do annual medicals, and maybe that time your body is behaving differently, so we are not able to pick that when you come for the normal routine general medical check. So you've been living with an infection, you've been living with a condition that is underlying. Let's say it's underlying. We're not able to see it clearly, but you have it. So when you get COVID, then this thing just takes precedence. It picks on those few disadvantages that you have, and then it just spirals downhill, yeah. And then number two, maybe it's just that it's an infection that is affecting you. Like people get flus, yeah. We can get the same variant of flu, but you will end up being very sick than the other person, and even the length of the disease varies. So now we react differently to diseases. Because each and every one of us is different. So now you cannot say that because you're vaccinated, you are not supposed to get COVID completely, and if you get COVID, then this thing is not working. No. Please get vaccinated, because it protects you from getting the severe forms of COVID. Yeah? And research is still going on about these vaccines. They might come up with another type of vaccine which will be advised by the scientists, and after being approved by the right bodies, we will be advised by the scientists on if we need to get another shot or a booster or whatever it is. They said even this COVID vaccine, you're supposed to get it every year now after you've gotten the 2 doses. It's not a lifetime immunity. So you're supposed to get it every year after you've gotten the first vaccine, these 2 doses that we are getting for AstraZeneca vaccine. And for Johnson & Johnson, it's only 1 shot. So after this, you're supposed to get a booster so that your body keeps on abreast with the immunity against the severe forms of COVID. So if you've not taken it, then I think you're doing yourself dishonor. You don't like yourself, actually. And the other thing I really want to put across is this notion that is going around, that it's the mark of the beast, the 5G, all those things, yeah? I mean, let's read our Bibles, yeah? For Christians, please, let us just read our Bibles and don't go by what people say, yeah? Because God is an all-knowing God. He's a God of wisdom. And if He sends people to have that knowledge to produce a vaccine, we really can't go back to where COVID started. Yeah, we can, yes. But it's not clear. We don't have that clear cut that it was manufactured. Even if it was manufactured in the lab, what are we supposed to do? Should we sit and die? Yeah, we have tried. The vaccine is here, but we are refusing to take the vaccine with a notion and a myth that it's a mark of the beast. If end times come, they have come. Yeah, guard your spirit, guard your soul, guard your soul. Let the body Don't be this person who says that I'll not take medicine because it is, yeah, that is now being cultic. That is not spiritual, that is cultic. Because there is no way, even when the children of Israelites in the wilderness, they were beaten by snakes, and God gave them knowledge to create another snake which will act like a cure for them. When they look up to it, they get healed. Yeah? God just didn't say get healed. You had to go an extra mile and bring people forth who will have the wisdom to help you through. So let us just cut this notion of not taking vaccine and saying it's a mark of the beast and all those things. We will die. Actually, if we continue like this, it's going to be worse than it already is. And because one, we are not even taking the precautions that we're supposed to. Yeah, people are not even putting on the masks in the right way. That is one thing that really irritates me. And you're telling yourself that if you have your mask on, I'm not hearing you. I didn't tell you I'm not hearing you. And even you, some people remove the mask because they want to listen to someone. Do you listen with your mouth? Yeah? I mean, let us just be, I don't know how to say it, but I think we've gone through those phases of a pandemic where one, people are scared of the disease itself, and then people just become lax, and people are tired. They become fatigued about the pandemic itself, and then people just decide to do some things that are not even imaginable. Yeah. So I just came here out today to just tell us. I think I came with 3 points. Yeah. 1 point. One, guys, let us take the vaccine. I am an ambassador of this vaccine. And on that note, I really want to give out a good shout out to people of Saitoti, which is Kitengela Sub-County Hospital. Man, those guys, the people at the immunization center, they're just awesome. They have very good rapport. They are professionals, you know. They don't give you that notion of a public hospital where we know you get there to be harassed. No. From the reception, everything was just good. Those guys are professional. So if you're around Kitengela and Kajiado region, you can get your vaccine from Saitoti, which is Kitengela Sub-County, and you'll get very good services, and you'll be advised. And before you get the vaccine, they will even ask you if you have any other condition. Do you have any medication for that? Are you pregnant? If you're a lady, and they will even give you they will give you 1 or 2 things to do. If you get fever from the vaccine, do you ever react to vaccines? Such things, you know. Those health talks are very important, and trust me, they will give you when you get there. And I was really impressed, and I was very, very impressed about their customer care and their services. I'm this kind of person who appreciates good things, and who appreciates, especially people who treat people nicely. I really appreciate, and kudos, guys, you did a good job. And it's not only me, but I have had many testimonials from people that you guys are doing a good job, and God bless you for that. Yeah, you're in your mission. That is your mission field, and you're doing well. So as I was saying, I came out with 3 points. Get your vaccine. 2, stop spreading the myth thing about the mark of the beast. No, let us not do that. Let us not discredit. If you don't feel like taking the vaccine, which is really doing a dishonest to yourself, don't speak things that you don't know. Don't spread rumors and lies about it, because you might prevent one person from getting that vaccine, the person who might have needed it most than you, and this person ends up in the ICU and dies. Don't you think you'll have killed that person? By the word of your mouth, you'll have killed that person. So let us be very careful on how we handle our words, especially around things that we're not very sure about. And 3, let us adhere to the M.O.H protocols. Let us put on our masks very well. The mask is supposed to cover your nose and your mouth to the chin. So when you speak, you're not spreading the virus around. It's not supposed to cover your mouth alone when you're speaking, because if it covers your mouth alone when you're speaking, you're inhaling the viruses from the atmosphere. Yeah, and the Delta variant, it said that the virus stays longer in air. Than it's a bit lighter, so it stays longer in air and on surfaces. So on surfaces, let us sanitize our hands and avoid touching stuff. Avoid contact in public spaces, especially. Avoid touching stuff here and there. And if you do, sanitize your hands. Or if you're able to access water and soap, please let's wash up our hands well and dry them, and avoid touching your facial area, which is your nose, mouth, and eyes, areas where we get the transmission. Okay. Yeah, I think that's about it. guys, I hope we're going to keep up with this, and I can't say I am I don't want to promise, because the other time I promised and I didn't keep my promise, but this time it's different. It's 2021, and I don't know how to say it, but I am psyched. Yeah, I am psyched. We're gonna do this, and I am very excited to have talked to you and just to share one or two things. And I promise that I'm going to be very consistent. Actually, I don't even know why I'm promising. I should just do it so that you people know that I am serious. Okay? Alright, it has been a pleasure being with you, talking to you. I've really missed you guys, and for those who are not feeling well, may you recover quickly. And for those who are having mild symptoms, just keep on taking a lot of warm fluids, just the normal care you take when you're having a cold. Just take a lot of normal fluids, take your vitamin C and the zinc that you've been given in the hospital, and maybe the azithromycin that you've been given. Just take them nicely, and don't forget to steam, especially with Kavol, which is a eucalyptus extract. It really opens up your respiratory system, because COVID starts by attacking those small air vessels down there, and it clogs them up, coming up and clogging up your whole lung. So if you take care of if you open up your bronchioles, which are those small windpipes down there, so you're able to breathe normally, and also avoid now going out. And please let us quarantine with our family members. If we have been tested positive, let us not go out there and spread these things. And if you have children and either the parents are positive, please just keep the children at home for a while, because these kids, most of them don't show symptoms, but they'll go and spread it to their other children, who can spread it to their parents, who might be under the population of the most at risk people. Okay, so let's be good, let's do good, and God bless you, all of you, and see you next time. Mwah.